Good afternoon, everybody, and welcome to this plenary session, working with policymakers to get research and evidence used. My name's Dr. Richard Kyle, and I'm Deputy Head of Research and Evaluation at Public Health Wales. Now, I'd like to thank you all for joining us this afternoon after what's been a fantastic day online in terms of the various different sessions. And also to note that during this session, towards the end of the session, we will be announcing the awards from the day that you've all been voting on during the day, which is fantastic. And just as throughout the day, I'd just quite like to encourage you, please, to continue to tweet, continue to use the hashtag ResearchWales20 so that we can start to get trending. We've been trending for the last few years. This conference has been happening, so please try to tweet if at all possible. And we're absolutely delighted that so many of you can attend the event. Throughout the day, we've had consistently more than 300 people attending, which is absolutely fantastic. And just looking just now, there's about 260, and it's totting up with each second that I look at it, which is absolutely brilliant. And obviously, this is the first time that we've done this online, and I think it's really a great way that we've been able to move online with this particular conference so that we can enable everyone to participate. Now, just to say, if there are any sort of technical issues that you encounter while you're watching this with us, then please just try to refresh and log back in. You can do that to try and overcome the issues if possible. And also do remember to ask a question, please, because it would be great if you can ask a question at the bottom of the screen, so that you can actually kind of contribute to the discussion. And what we'll do is we'll pick up some of those questions at the tail end of the sessions, and we can feed those back to our brilliant speakers this afternoon. What I'd like to just do is just to start off by offering some of my own reflections, and I'd like to thank Health and Care Research Wales for the opportunity to chair this session, and also for the chance to offer some of these opening reflections on working with policymakers to get research and evidence used. It's something that I've actually been reflecting quite a lot on since sneaking into Wales a week or so before national lockdown, to start my role at Public Health Wales on the 30th of March. I mean, how often over the past few months have we heard that these are unprecedented times? How often have we heard or even said that phrase today? And it's true, this year we've all been walking paths that we've never had to walk before, professionally, personally, and also emotionally. But with each step, research and evaluation and evidence has been absolutely vital. For many, the skills that they've finally honed over years, possibly even decades, have come into their own. From the perspective of Public Health Wales, from our microbiology and genomics teams, and across Wales in the organisation and across Wales, they've worked tirelessly developing new approaches to mass testing and the setting up of large-scale rapid sequencing and analysis of COVID-19. Our epidemiologists have been tracking and modelling the spread of the virus to inform life-saving action. And to those in our research and evaluation division that I'm very, very proud to now be part of, who in a short few months have delivered rapid evaluations, have developed a community response map to help voluntary organisations and others see and respond to the emerging needs of people across Wales, and have been instrumental in establishing pioneering studies of seroprevalence in healthcare workers, as well as enabling people in Wales to participate in the clinical trial of the Oxford vaccine. Never before has research and evidence been so important, and its contribution to frontline response to COVID been more clear. And never before has research and evidence been so front and centre in people's lives. Everyone is engaged at some level now with research. People are talking about it, Zooming about it, tweeting about it, reading it, arguing over it. Evidence is everywhere. But when I think of the unprecedented times that we are living through, I think about two things that have made this particular period unique: pace and purpose. We have all across Wales, and with colleagues beyond, worked to a lightning pace to generate and use evidence, propelled in our efforts by a common purpose. And when I think of the topic of this afternoon's plenary and reflect on my own experience, so often the key to getting research and evidence used comes down to these two things: pace and purpose. Thinking back, it is often when the pace and purpose of people and organisations align that evidence is put at the heart of health and care decision making, and that space is created for timely, relevant, applied research questions to spring forth. As a community of researchers across a range of organisations and disciplines, we have been saying for a long time now that we need to come together, that we need to be better at sharing good evidence and new ideas across primary, secondary, social care and community settings. Now, I'm an optimist. I believe that for all the tragedy and sadness COVID has undoubtedly caused, it is also a period that has presented us with an unparalleled opportunity that we can seize. Because of COVID, we have worked together at pace. Walls we thought would get in the way of collaboration have tumbled almost overnight. We have quickly learned how people and organisations really work, with all their wonderful quirks and idiosyncrasies. But because of COVID, we have also found our common purpose: one single-minded mission: to use our collective talents, our assets and our strengths to ultimately save people's lives. COVID has taught us that when pace and purpose align, that we can achieve the unachievable. And I just encourage you to take a moment now to just reflect on what you have achieved personally these past few months. It is quite simply outstanding. So as we move towards hearing from our two excellent speakers this afternoon, I'd encourage you all to reflect on how we are now best placed to grasp the opportunities that COVID has given us, to ensure that research and evidence continues to inform policy and practice. As we listen and learn from the lessons Paul and Steve will share this afternoon, we can ensure that we don't lock back to the way things were, that we don't rebuild walls. Instead, we can look forward through the new open doors that have been opened towards ever closer relationships between research, policy and practice that will benefit the people across Wales that we all serve. So I'd like to take no more time and try and introduce both of our brilliant speakers this afternoon. First of whom is Professor Paul Kearney, and Paul is Professor of Politics and Public Policy at the University of Stirling in the UK. Now, Professor Kearney's research interests are in comparative public policy. His research spans comparisons of policy theories, which are you can read about in his book Understanding Public Policy, published in 2012, in methods associated with key theories from a text handbook of complexity and public policy from 2015, and in international policy processes in his text Global Tobacco Control from 2012, as well as comparisons of UK and devolved policy making. Now, Paul uses these insights to explain the use of evidence in policy and policy making, and has brought us together in one book, The Politics of Evidence-Based Policy Making, in 2016, and several articles and many blog posts. Now, our second speaker today is Professor Steve Martin, and Steve is Professor of Public Policy and Management at Cardiff University and Director of the Wales Centre for Public Policy. Now, Professor Martin works closely with public service leaders and the Welsh Government, ministers and with senior academics to provide rigorous evidence that helps to inform policy and practice across Wales. Steve is also a member of the UK's What Works Council and editor of the leading international journal, Policy and Politics. Steve has served as an advisor to numerous government departments and agencies in both the UK and across Europe, and led to more than 50 major research projects, by research councils, charitable foundations, and governments. So without further ado, I'd just like to hand over to our first speaker, Paul Kearney. Thank you very much, Paul.
Thank you. I've just got 4 slight pieces of housekeeping to describe before I talk. The first is when universities started to go online for teaching, we got this email around that said, don't put too much pressure on yourself. You'll never reach Lorraine Kelly levels of online presentation. So I'd like you to bear that in mind. This isn't like the dynamic lectures we'd be used to giving. The second is there's a decent chance that if someone comes to my door, the dogs will bark the whole way through my presentation. So I'm going to try and power through, but just let me know if that's a little bit off-putting. The third is that we're going to recreate the kind of UK government style presentations by saying, next slide, please, but it's not as important as those ones. Now, the fourth and most important one is that Steve just emailed me to say that he's having trouble with his connection, and I have to alert the technical team. So I don't know. It's okay now. It's okay now. Well, that's a relief. Okay. So with that in mind, I think the pressure's off, isn't it? Okay. So could we go one slide back, please? Okay, right. Okay, so here's the question that I'll be talking through. Why don't policymakers listen to your evidence, and what can you do about it? And this is the most common question that people ask me to talk about at this type of event. Sometimes because I ask them to ask me that, to make my life a bit easier, but often because this kind of question sums up a frustration within a lot of health and scientific circles that they have, at their fingertips, the best quality evidence, but that policymakers don't know about it, or don't understand it, or don't know what to do about it. So that's usually the concern with which I engage. But what I would like to do first is pretend that we're in a group of about 20 people in person and not an online event with about 300 people, and ask you some questions about what does good evidence mean and that sort of thing. So I guess we can, if you're feeling energetic, you can answer one of these 4 questions in the chat, and we can take it from there. So next slide, please. So here are the questions that I would tend to ask people, in an audience, just to work out how to tailor the sort of things I'm going to say. I don't know, I won't leave it long for you to answer these, either in the chat or just in your head, because it's a little bit awkward, isn't it? We're all kind of staring at my face on the screen. But here are the kind of questions that I think we need to have in mind when we go through answering that kind of question about why do policymakers seem to ignore evidence. The first is, ask yourselves, what exactly is good research evidence? And how do you gather it? Now, that has a particular importance in fields like health, because often we're used to hearing about a so-called hierarchy of evidence in which the systematic review of randomized controlled trials is at the top, and expertise is quite close to the bottom, and things like practitioner experience or user feedback maybe doesn't even feature. So that's a kind of small p political choice we're making already about what counts as good evidence. Okay, so that's very handy from Georgia then, because to establish a good evidence base, we need engagement with a wide range of individuals from different groups. Okay, now that is what I think would count as a very legitimate way to think about evidence, but it's one that does not feature in hierarchies of evidence that we talk about. So the first thing we would normally do, I think, is to think about, do we hold the same assumptions about what counts as good evidence? And I think if you get a decent sized room, you'll have a bit of either implicit or explicit disagreement on what counts here. Okay. Now, interestingly, so far, apart from people wanting to hear my dogs, most of the answers are about feedback and experience and that sort of thing. So that, I suppose, that would be a sort of different audience that I'm used to speaking to, who tend to be scientists or public health people who are much more likely to talk about methods, scientific methods and things published in peer-reviewed journals, that sort of thing. Okay. So I think some of the chat has answered that question about what other knowledge is relevant. I suppose, what about, okay, so we've got question 3, which is how do you put it all together to make something evidence-informed or evidence-based? So in response to Kylie, yes, it does depend on the question you want to answer. And so I think Francis is talking about evidence synthesis. So that is one way to put things together. You have a professional or an analyst or an academic who tries to bring together all available evidence into an evidence base. But another way to put it all together is some kind of collaboration or co-production process between people providing evidence or knowledge and people who need to use it. Okay, so we've got a bit of a mix of answers to this question. Okay, and so one response is Cochrane collaboration. So thank you for that. That's like the classic response. And I think for some, that would be the way you would put evidence together. But I think for many others, it would not. Okay. So in terms of question 4, this is the question I like to ask, just to annoy some people, but also to prompt people to think about, are they actually apolitical and just providing the facts, that sort of thing? Because I would say, I mean, I'm very biased because I study politics, but I would say everyone is a political actor, because politics is finding ways to resolve a conflict of preferences. And, politics is about making choices in which some people win, some people lose, or their aims win out or not. And that makes us all political actors. And I think we sort of do a disservice to the process if we think that, elected politicians are the only ones that are political and people providing evidence are sort of, what would be the word, objective. Okay. Okay, so thanks, Ailsa. So you agree with me? That's good. I mean, I would quite like to stop there. We get a bit more agreement, and that's good. But otherwise, next slide, please. Okay, so I want to relate that kind of discussion to the sort of 3 stock answers I would give to answer that question. Why do people ignore my evidence, or why is there no such thing as evidence-based policymaking? Okay, next slide, please. Okay, so the first explanation. And as you can see, there's a customary sort of self-publicity for every slide. Okay, so all of these kind of books or articles are available on my blog as well. So the first is that policymakers have different ideas to scientists or researchers about what counts as good evidence. Now, I've put that in a particular way, but you could equally say lots of researchers have different ideas about what counts as good evidence. And some of the biggest, political disputes are between researchers, not necessarily between researchers and politicians. Okay, but the second point is there's no such thing as a single center of government or a single core executive that you can appeal to. In political systems as large as the UK's or as large as the Welsh political system, there are many different policymakers and influencers spread across levels and types of government. Okay, so if you imagine, the first explanation is essentially that there are lots of people involved. There are lots of legitimate sources of policy relevant knowledge, and therefore lots of different ways to resolve the relationship between evidence and policy. So from my perspective, I never really ask, why is policy never evidence-based, apart from rhetorically, because the question doesn't make sense to me, because, it's the only way to make sense of it is to have a very narrow conception of that question. If you accept that there's a wide range of knowledge and a wide range of policymakers, it just doesn't make the same sense anymore. Okay, next slide, please. The second explanation relates, I think, increasingly to a kind of very, what would you call it? A steep rise in social science interest in psychology. So there are classic ways to describe this, but I think increasingly we describe this second explanation in terms of psychological concepts. So essentially, the most, what do you call it, provocative way to answer the question here is to say that all humans have to ignore almost everything almost all of the time, or all policymakers have to ignore almost all evidence to help them make choices, or to say there's an almost infinite amount of information out there and a very finite ability to process it. So instead of thinking about building up knowledge or filling knowledge gaps, I would encourage you to think of how to reduce, a mountain of knowledge into a manageable amount. I mean, I think that's what policymakers are looking for. They're saying to people, there's too much out there. Tell me what I can ignore and what I can read. But we all use these sort of cognitive processes to do that anyway. So one is to set goals, identify good sources of information so that we can limit who and what we listen to. But the other is to go with our gut, or to go with habits or norms or emotions or beliefs, so that we can make really quick and efficient choices in a very small amount of time to decide what a policy problem is, and then to seek information about how to address it. Okay, so that's the second explanation. Essentially, the answer to the question, why do policymakers seem to ignore my evidence? Well, the answer is they have to ignore almost all evidence. So I wouldn't take it too personally. Next slide, please. And the third one, I think, is the most complicated to get into, but I think these visuals really kind of sum it up quite nicely. Okay, but before I do so, Elsa's question is, what about cognitive bias? Well, the entire second slide there was about cognitive bias without me using that phrase. Okay, I actually edited it to take away that language because it has unintended consequences. Okay, and so Chris has said, good researchers and policymakers adopt more critical ways to filter information. Well, so, I mean, I'm not saying that people are using good or bad ways to filter information. I'm saying that they have to find some way to do it. Okay, so there's no sort of technological other way that stops us having to ignore almost all information. Okay, so this is handy, actually. I wouldn't get this feedback normally in a big room, so thank you for that. So the third thing is we sometimes have this sense that we know who policymakers are and what their processes are. And it's summed up in simple images like the one on the left, which is the classic policy cycle. You know with whom to give evidence and when, just according to stages. But almost all policy process research tells you that the policy process is much more like the top right. This kind of real complicated system where it's very difficult to entangle where everything fits in. Now, interestingly, if you look at the bottom right, there are parts of the European Commission who have a fairly similar looking image. And I once spoke to the person who produced it, and just to check that it wasn't a causal diagram, but it's essentially a kind of big spaghetti thing where the image is there to say, okay, even we don't really know what our policy processes are. So imagine that. Imagine a very well-established policymaking organization putting up a slide that says, okay, we have a sense of what the policy cycle should be, but here's what we think it actually is in practice. Now, so the third explanation would be, it's very difficult to find a relationship between evidence and policymaking because it's very difficult to conceptualize and understand policymaking on its own. Okay, next slide, please. So the obvious question there is, what should we do about it? And I suppose you could listen to those first three slides and think, what I should do about it is kind of, give up or have a rest or something like that, because it just, if we don't really understand the process, then how can we engage? But really all I was doing was kind of trying to manage expectations. If you reduce your expectations right to the bottom, then you can have a lovely surprise when things work out a little bit. So let's begin by trying to connect policy process type research with sort of some kind of popular top tips about how to respond. Next slide, please. Okay, so this is all based on understanding how policymaking works and then trying to map key concepts onto simple options. Next slide, please. Okay, so to be honest, I'm quite interested in the psychology of these kind of images, and I've tried to design this. I mean, it's only in Word, I'm not a graphic designer, but I've tried to design it to look quite pleasing to the eye. It's blue, a nice kind of pleasing blue, and with a kind of, it looks a little bit like a turtle. Okay, but the more important point is that these concepts sum up key parts of the policy process. So in the middle, I've got that, psychology of choice. This is people trying to process information to make choices, surrounded by a policymaking environment with 5 main elements. And I guess we're a little bit short for time, so I'll go through them quite quickly. So from the top, clockwise, you have these concepts. Actors would be, there are many policymakers making and influencing choices in many different policymaking venues spread across political systems. Then you have institutions, which says in each of those venues, there are formal and informal rules that guide all political choices. So some of them are written down, but many of them are communicated non-verbally, and it takes a long time to work out the rules within particular organizations. The third is networks, and that is the relationship between the people who make policy and those who influence policy. And they can be pervasive across governments, and they can help explain how governments process most policymaking. The fourth is ideas, which in a nutshell would be that in each venue, there's often a dominant way to understand policy problems and feasible solutions. And often those are so dominant that they're taken for granted. So I think the kind of classic examples would be, in Treasury departments, you expect a kind of paradigm to be about things like value for money, whereas in health or public health units, the kind of equivalent thing that people would take for granted is, what methods really matter for producing research and that sort of thing. And then finally, you have context and events. So I mean, context is everything, of course, but events would be things like crises, such as the one we're facing this year, but also events can be much more routine. Like an election of a new government, presents new constraints and opportunities for people, presenting evidence. Okay, so Alison's question is, where does evidence fit in turtle diagram? Now, I would answer that. If you like, I do have another image, but I put it on Facebook once, and someone asked if one of my children had done it. So I'm not confident I've got a good image for you there, but it's something that we could talk about as we go through. Okay, next slide, please. Okay, so note to self, don't use all the space in a PowerPoint slide. Okay, but that says simple responses. I mean, so this is me kind of coming towards the end of my presentation, and essentially I'm saying that you can come up with 5 responses based on what we've talked about with the policy process. And they sound really simple at first, but if you think about them, they are actually Herculean tasks. Okay, so the first one is, if there are many policymakers spread across government, find out where the action is. Find out where you should spend your time, given that you've got many choices. Now, that's a tricky one if you spend most of your time doing other things, because I devote most of my career to studying policy processes, and I'm not confident I would know exactly who to speak to in any particular case. So, if your day job is doing research, I think that's quite a difficult prospect. And they get more difficult as we go along. The second is learn the rules, and so imagine, you want to learn what the rules of the game are so that you know how to act and how to anticipate the ways in which people will respond to you. But, if you've got experience of organizations, it takes a long time to understand the informal, unwritten rules of organizations. Often you only really understand them if you work there for a few years. So that's a tricky prospect. Go in with evidence and learn the informal rules. These are very difficult to do. The third is learn the language or the are in good currency. The ideas that matter. That might be more easy, but I think what it suggests is you could have a good sense of what ideas matter in one venue, but when you shift to another one, you're a novice again, and it's very difficult to pick up what people's unwritten frames of references are. The fourth is build trust and form alliances and networks. Easier said than done. And the fifth is exploit changing conditions or crises or events, which is, again, easier said than done, isn't it? I think we're used to hearing this phrase, this event creates a window of opportunity for something. But it's very difficult to then translate that into what you can actually do to help contribute to that window. Okay, next slide, please. Okay, so this is my penultimate slide. I should say I'm petting one of the dogs as I speak. I think this should be okay. I don't think she's going to bark if I keep close here. A lot of these ideas are quite sensible. And they're quite common throughout, training programs. Tell a story because evidence won't speak for itself. Maybe a bit, this is a more political thing. Get attention for your story at the expense of others, because attention is a resource like any other. Be flexible because that one strategy in one venue will fail in another. Form coalitions and learn from entrepreneurs. There's this phrase policy entrepreneurs that people use to suggest that some people have the networks and the skills and the tenacity to bring all these things together. Next slide, please. But I mean, this is my kind of more downbeat note before Steve, you build us up again, which is, in studies of policy entrepreneurs, almost all of them suggest that it's the policymaking environments that cause outcomes. It's not the entrepreneurs themselves. He would also say that the opportunities to exploit windows of opportunity or the rewards for engagement are not shared equally among social groups. There may also be very few incentives to develop these skills because we all have day jobs and what I've described as another profession. So maybe the solution is to rely on organizations who do this well. And my final point is there are no quick fixes. But that's a nice segue to Steve, who might disagree. He might have in his pocket 5 quick fixes. Okay, thank you.
Thank you very much, Paul. And just before we move on to Steve, can I just encourage people to, if they've got any questions while things are fresh in their mind, just to jot them into the question box. And I'll just hand back over to you, Steve. Thank you very much.
Thank you, Prynhawn Paul, and thank you very much to Kieran and his team for inviting me. I think the original invitation was back pre-pandemic, so we might have been meeting in person in my mind. So this is very different, but equally good. So I'm not sure that I'm going to be able to lift the mood, assuming that Paul's right that he's depressed the mood, which I don't think he has, because he and I have, I think, very similar views on much of this from slightly different sets of experiences and perspectives. But I've read Paul's work and I've listened to him over a number of years, and perhaps it's influenced us in ways which means there's some coincidence between our slides today. My background is as a career academic, if you can call it a career, and I spent 25 years doing quite applied policy, public policy research, and observing that it very often wasn't used in any tangible way, in spite of the brilliance of the work that I and the teams I was working with had done. And in the last 6 or 7 years, I've spent my time setting up the organisation, which is reflected on this big slide in front of you, whose purpose is to try and wrestle with that set of issues about why is it that so much good social science research, I think I'll narrow my focus to that, seems to go unnoticed by policymakers and practitioners, and if that is the case, what might be done about it. Next slide, please. And it does feel so odd to say that phrase. So I thought I'd very quickly talk to you about our centre as a way of illustrating some of these issues that Paul's been talking about. I'll try and be really honest about what we've done, what has worked, what hasn't worked, some of the tensions that are involved in the role that we have, explain why we do it, and perhaps sum up a little bit at the end on what we've learned so far. And I included so far initially, then I deleted it, and then I put it back. And I think it's right to have it there because the organisation I'm talking about is now 3 years old, but with a prototype which existed for 4 years prior to that. And I would say that we're still learning pretty much on a weekly, if not daily basis about how to do this, how not to do it, and how sometimes you just can't do it, however much you want to try. And next slide, please. So our mission is to support public services in Wales and Welsh Government ministers, and that's an important thing to note. Policy making is highly decentered in the way that Paul has described, and we have a particular part of Welsh Government that we seek to speak to and with. And our aim is to help them to access, understand and apply evidence which we hope, think, believe can help improve policy making and service delivery. So I hope that makes sense as a mission. It's kind of like Mission Impossible. The mission, should you choose to accept it, Steve, is to do this. Next slide. And we do that in 5 main ways. We thought that we should have a theory of change because every other evidence centre that we know of has a theory of change. We ended up moving away from that because it was too linear and implied cause and effect in a way which we weren't comfortable with. So we now have something which we call our framework, which is a terrible name for it, but it seeks to describe the main kinds of activity that we engage in. And we do 5 main things in pursuit of that mission that I just described. Firstly, we identify and interpret policymakers' evidence needs through a process of dialogue with them, but also by being plugged into some of those networks, formal and informal, that Paul was talking about, and keeping our ears close to the ground in terms of policy developments, the event and the context that Paul's turtle slide alludes to. Having done that, and it's not a linear process actually, but in light of our understanding of evidence needs, we then seek to convene evidence and expertise. And we could have a whole debate if I leave time for any questions about what we mean by evidence. I'll sidestep that for now, but we don't get overly hung up on RCTs. I'm sorry for those of you for whom that's heresy, but we find that it's better probably to produce some evidence than to discount the evidence and expertise that is available because it doesn't match somewhere near the top of the hierarchy, as it were. So we deal mostly in existing evidence. We're also happy to help ministers and others, public service leaders, to access expertise which is informed by social science research evidence. We communicate that in a variety of ways. Well, of course we do. But in a very small way, we're also seeking to build capacity to use evidence, mostly by modelling it in truth, but also by training some of the early career researchers who work within the centre. And then finally, we have a programme of research which is designed to reflect on our own practice and learn from that about this whole endeavour of evidence-informed policy. So to better understand, by dispassionately observing what we do, what we can learn about how evidence might inform, in some ways, policy and why it doesn't very often. Next slide, please. Sometimes people think that we are the Welsh Government's centre, working only for Welsh Government, or for worse still, Welsh Labour government we get accused of being bound to. We are part funded by the Welsh government, but we're also funded for more actually by the Economic and Social Research Council, and the university in which we're based also provides a very large amount of our funding. In addition to that, we've got a whole series of projects running. So those are our three core funders, and then we've got a series of projects which other agencies have asked us to take on. Next slide. No, yeah, thank you. And I think Richard said in his introduction to me, which sounded far too long and grand, that we are part of this movement called the What Works Network. It's a very diverse group of centres actually, with very different mandates, missions and views about what counts as evidence. So there's a kind of caricature of a What Works centre. We're very happy to be kind of fellow travellers with all of these different What Works centres, and what we try and do is to take the work which they've done, which mostly has an England focus, and make sure that it's known about in Wales and used where it's appropriate and helpful to do that. Two of the centres are actually based in Wales, including us, but without us kind of constantly reminding them from across Offers Dyke, there tends to be a very English-centric mentality amongst the centres. So we hope that we play a role in reminding them that there are four nations in the UK, and that the policy-making landscape is slightly different in each of those, although the policy challenges are very, very similar. Next slide, please. The key thing about our approach is that we try and be demand-led. So the 25 years that I spent doing research rather than seeking to mobilise and broker it were largely based on ideas that I and my colleagues had. We'd go and do a piece of research, whatever we mean by that. We'd conduct research, and then we'd seek to generate some demand for it. We'd push it out there in a variety of ways and seek to engage with potential users of the evidence we produced. We've tried to invert that and start with what are articulated as evidence needs by policymakers and practitioners, and then go and seek out the evidence that already exists that we think might address some of those needs. We try and be non-partisan. I can come back to that in questions if you want, but there's a very long story around that which we haven't got time for. Because we use existing research evidence, we're able to turn things around much more rapidly than I did even at my most manic when I was leading research studies. And we have a blended team. We're by no means not all career academics by background. We've got a staff of 20 from the civil service, the private sector, consultancies, local government, the third sector, national government itself, both UK and Welsh government. And we're very heavily dependent on outside expertise. So we cover potentially all of the devolved areas of responsibility in Wales. Even a team of 20 cannot claim to be the leading experts in each of those areas. So we seek to partner with people who are. It's kind of like, well, I don't know the answer to that, Minister, but I can find a woman who perhaps does. And then we seek out the experts with whom we want to work. Next slide. Next slide. I think I'm going to have to skip some of these quite quickly. We know that the world isn't like this, and this is a very outdated model called the two communities model, dates back down to the 1970s. But I still think it is the case. There's some truth in the fact that government policymakers on the one hand and traditional academic researchers on the other do inhabit rather different worlds, cultures. They have different incentives. Really, the wonder is that they ever manage to speak to each other, not that they don't often speak to each other. And that sort of implicit thinking, at least, has underpinned the model that we've developed. Next slide, please. And therefore, endorsed by a whole range of researchers in recent years, we think that there is an important role for what I'm going to call evidence intermediaries, people who understand some of the things that are on Paul's diagram, turtle diagram, whilst also understanding how to persuade academic colleagues to engage and to support them to get the best out of their research through that impact. So that's again a very simplistic diagram. That there isn't one bridge, there are multiple overlapping and crisscrossing and confusing bridges, but we seek to build bridges between those two communities through the work that we've done. Next slide. There's some of our recent work. Perhaps we can circulate the slides and you'll be able to see that. I'm not going to read off the slide to you. We've got, I think, quite a good website. We provide a quarterly newsletter. If you don't already follow us on Twitter, if you're interested in finding out what we do, there are numerous ways to do that. I'd just say, though, that we have those main themes to our work. At the moment, 6, used to be 5 until the pandemic. How could we not include the pandemic as a 6th if we're demand-led in our approach? But those themes of economy, health, social care, social justice, sustainability and effective policy making have stood the test of time, and most of the work that we do fits reasonably well under one of those headings. Next slide, please. I'll skip that, that's quite boring. I can talk about how we actually go about a project in questions if you want, but we've found that it's really important to have a rigorous project planning process. And we've found that where I think we really add value is at the early stages when we're identifying an evidence need, interrogating that, scoping what that would mean, understanding where we can add value if we can, and towards the end of the process where we're facilitating a dialogue between policymakers and researchers to interrogate the evidence and make sense of it, to understand what it means in the particular context which we're working in Wales with public services or with ministers. But I won't labour that slide. Let's have the next one, please. A whole range of outputs. We've learned, partly by listening to people like Paul, that you don't just write a report, although we do usually write a report, but it's the process of getting to a report which usually provides the valuable learning and the dialogue between policymakers and evidence producers, if I can put it like that, academic colleagues and other researchers. And we very early developed a whole series of methodologies around expert workshops and roundtables, and we've had ministers come to roundtables and debate with and learn from experts. We've had special advisors, we have senior officials regularly coming to quite small events, usually 5 or 6 experts together with up to 10 or so policymakers, presenting evidence, talking through the evidence, trying to understand how it would apply or wouldn't apply in the particular context that we live and work in. Policy briefings, letters to ministers which say the things that we wouldn't necessarily want to say in a report, blogs, conferences, and so on and so forth. Everything that we produce is published, and I've been quite insistent on that from the outset so that we don't become a kind of private think tank for ministers or local authorities or whoever else. So I hope that our work is kind of freely available. Well, it is freely available. I hope it's useful not simply to the people for whom we originally kind of design it. So everything's free to download from our website. Next slide, please. Good, I thought that we were nearly at the end. So I long ago coined this rather kind of corny set of phrases, so I developed the 3 R's. And I think what has made us successful to the extent that we have been is first and foremost relevance. If what you're saying doesn't seem to be relevant to the preoccupations that policymakers have, you probably might as well not bother. But also what differentiates the work that we try and do from the multitude of stakeholders who lobby ministers and others on a daily basis is that we're trying to make sure that we're producing rigorous research evidence. Now, it's only one of very, very many inputs into this decision-making process. I'm not for 1 minute claiming that's the only kind of evidence or knowledge, but it's the evidence in which we deal. And then thirdly, I think relationships are absolutely key to this, building up the trust and the credibility in both communities. Without that, again, it feels to me like a non-starter. And then I think there's a final slide, please. So stepping back a minute from 7 years of doing all this, I would say this, wouldn't I? But I think that I've demonstrated to my own satisfaction anyway, that it's possible to play the role of an evidence intermediary. It's not always easy, but it does add value. The policymakers do need support to identify their evidence needs and understand where they might go to meet those needs. And there are many really skilled academics who don't need to come anywhere near my centre in order to have a lot of impact and traction. But there are others who do value the support and the ways in which we can open doors for them which they might not have known to open themselves. Particularly in our case, bringing in people who are not familiar with the Welsh context but have a lot of expertise that's very relevant to the issues which Welsh policymakers are grappling with. Fewer than about a fifth of the experts who we work with are based in Wales, to the chagrin of most of my colleagues at Cardiff. So part of our mission has been to bring a much more diverse range of voices into the kinds of debates that we're having around evidence. And then, as Paul has said, I think you need compelling and politically savvy narratives if you're ever going to gain traction. And finally, as Paul has said, don't be disappointed. Evidence is only one of many, many factors in play. Sometimes we have an effect, very often we don't, even though that's our main raison d'etre. So a lot of this is out with our control and will be out with the control of our research colleagues as well. Thank you.
Thank you very much, Steve, and Paul, for those fantastic presentations. And I think there's a lot of food for thought in both, and some neat parallels between the two, which I think we can take some time to reflect on in terms of our own work and our own practice, and how we can affect change and influence, I guess, in terms of bridging the two worlds. I think it would be really useful. I'm mindful of time, but I think it would be great to be able to put at least one question to you both, which has been shared in the Q&A. And I think there's a few points here that have been raised around skills and knowledge and particularly expertise. And one of the questions that we have here is, does it help or hinder when policymakers and system leaders have a background in science or research? And as a supplemental, should we be trying to upskill, inform, change their attitudes and beliefs? Paul, do you want to kind of try and tackle that one first, and then I'll come to you, Steve?
I should say that is one of the most popular solutions given by academics, which is to put the onus on policymakers to solve the problem. So I'm not saying it's a bad idea, but I think it would only solve one aspect of the problem and probably exacerbate a few others. I mean, I know if, for example, if I was a policymaker, and I was kind of quite well trained in research methods, I think I would have quite a hard time accepting a lot of the evidence presented to me, because I would be, one part of the scientific approach is to engage critically with it. So I would imagine if you want to be, super political and you focus on what you want, sometimes you don't want a really skilled researcher as an audience. You want someone that you can persuade, with the weight of your authority.
Yeah, some of the best, this is invidious, I'm not going to name names because Wales is a small place, but we do work with officials and public service leaders who come from an academic background beyond simply a first degree, and in some cases beyond a PhD as well. They've held quite senior academic appointments. And I think they're stimulating people to work with. They're more demanding customers than some others. So I would be in favour of that, but I think that's a helpful thing, not a precondition. It's more about an attitude of mind. It's more about a curiosity and an openness to evidence, a willingness to risk looking at the evidence, even if that cuts across some of the preconceived ideas that you have or the political values that you're working to promote. So I do think it's more about people's own temperaments and personalities and the extent to which they want to play it safe or to be open to challenge which evidence might bring.
Thank you very much, both. I'm just going to follow up with one little question, actually, a final question, which was, picking up on your point there, Steve, how do we cultivate that curiosity? Because obviously as researchers and as policymakers, practitioners, we're all very curious. We stumble across things every day that spark that little bit of curiosity that then leads us to follow a research project or improvement project or something of that ilk. Are there ways that we can do that to cultivate that curiosity?
So you can guess my answer to that is to be relevant and useful. Those would be the two. So we haven't had the debate about evidence standards, but I would say rigorous evidence that's useless is not good evidence. So to be good, evidence has to be useful. And excuse me, you might then question, well, what do you mean by useful, Steve? And that would be a good question to ask. But if policymakers can't see that this is addressing the issues which they came into public life to grapple with, then why would we expect to get a hearing, would be my view.
Can I just jump in a little bit there and just say, yeah. So one way to find out, so Steve would know this more than most, but I think one way to find out what would be useful is to speak directly with policymakers and other people to find out what they want to do and how they think about those things. And that's often a long-term process, isn't it? Where you're developing a level of trust where they'll share with you what they want to do, and then you'll know what will be the value of your research. The other thing was, I noticed that the top question was what happens when politicians deliberately ignore the evidence. And I should have said that at the start of mine, that obviously one of the answers to my question would have been that politicians do that a lot because they're cynical or they're in it for themselves, that sort of thing. And I think part of the benefit of both of our talks is to say we offer another answer to that question beyond the usual pub talk about politics being pathological. Even if you met a group of sincere, well-trained, scientific, well-motivated policymakers, you would still face all of those problems that we've talked about today.
Well, thank you very much, Paul and Steve, for those really, really relevant talks and some really, really helpful guidance and insight there, I think, for our work. And obviously, if we were face to face, I would be encouraging everyone to give you a round of applause, and I suppose people could potentially do that through the chat. But thank you very, very much for your contributions today. I just want to move finally to the last part of our session today, which is the award giving, which again is going to be rather odd without rounds of applause and kind of cheering and whooping, which usually accompanies awards. But do try and express that as best you can in the chat. That would be absolutely fantastic. So we have 3 awards that we're going to be giving out today. One for the best oral presentation, one for the best virtual exhibition stand, and one for the Public Involvement Achievement Award. And I'm going to go through them in that particular order. Now, the best oral presentation, this is with huge thanks to the technical wizardry and the technical wizards that have put on today and been able to enable voting on this throughout the day. But the best oral presentation has been voted for by yourselves, the participants of the conference. And out of over 50 presentations that have been submitted, the winner of the best oral presentation today is National Video Consultation Service, Embedding and Scaling Up Innovation, which was an oral presentation by Alka Ahuja. And I hope I've pronounced that correctly. But congratulations very much to you, Alka, for that presentation. The winner of the best virtual exhibition stand, again voted for by the participants of the conference, all of you today, is Health and Care Economics Cymru. So congratulations to both of those very well-deserved winners of those awards. Now, the last of the awards is the Public Involvement Achievement Award. And this award aims to identify, promote, and celebrate the excellent public involvement taking place across the Health and Care Research Wales community. Now, the UK Standards for Public Involvement have provided the foundation for the award, and we'd like to thank those who submitted entries and to the panel for giving their time in judging this award. And I'd like to name the panel specifically because I know that this has been a real piece of work for the individuals involved. So thank you to Adewale Adebajo, Una Renard, Alex Newbury, and Barbara Moore for your work shortlisting the entries down to 4, which you will have been able to see on the conference website, and you can jump on the conference website to have a look at each of these in a bit more detail. Now, we have 2 highly commended entries by our panel, and the first of which is for Cheney Drew, who submitted Domino HD. Now, this is an example of a successful cross-cultural engagement with public and patient representatives to design a multinational observational study. The panel commended the scale of public involvement involved in the study and the approach to ensure that the reach of public involvement was spread across all of the countries involved. So congratulations, Cheney Drew, for Domino HD for that highly commended entry. Also highly commended was Dr. Julie Latcham Hastings with LEAP MS. Now this was involved co-producing a lifestyle, exercise and activity package for people with progressive multiple sclerosis. The panel commended the study on the commitment to the development of skills for public members and how the team was able to fully support those being involved in the research. So congratulations to you both for these highly commended entries. Now we reach the runner-up, and the runner-up of the Public Involvement Achievement Award this year is Professor Louise Condon with Just Recruiters. Now, this rich contribution of peer researchers to a study of Roma, Gypsies and travellers' experiences of cancer. The panel was impressed by the level of public involvement integrated within the study and how the researcher was able to demonstrate a well thought through approach to public involvement and how that can shape the success of a project in a hard to reach community. So that leads us to the final entry, and the winner of this year's Public Involvement Achievement Award is Co-Producing Sustainable Adult Kidney Services. Congratulations. And this is learning from the Dialysis Options and Choices study submitted by Leah McLaughlin. This application was a great demonstration of innovative practices to support and deliver public involvement as a core part of the research study. And the panel again was very impressed by the commitment to involvement throughout the governance and management of the research, and the fact that there was clear evidence that all aspects of the UK standards for public involvement had been considered as part of the work. So congratulations to all our very, very worthy winners. Today is absolutely fantastic. I can hear the virtual whooping from the chat box. I think it's absolutely fantastic that we're really focused on public involvement and how we can actually enable people to be truly involved in the research that we're doing. And it comes back to some of the comments that were raised during our plenary this afternoon. So just before drawing things to a close, just a couple of thank yous. First of all, I want to thank all of you for participating and attending during the day today. It's obviously been the first time that this has been done online, and I think it's been an absolutely fantastic success. My hats off to the technical team who have made this possible, and also especially to the communications, engagement and involvement team at HCRW. I know that this is quite an achievement to be able to do something like this over the course of a day, and I'd like to thank you all for this really hard work that you've done. So just to bring things to a close, I hope that you've had a fantastic day, that you've learned lots, that you're going to be able to put that learning into practice very, very soon, and that you've also had the opportunities to share. And I would encourage you to, if there's been comments who have comments from people, that you kind of make those connections, pick up those connections and take those forward in the same way that you would if this was a face-to-face conference. And of course, we will see you all again next year. And thank you very much for taking part once again.